Welcome everyone to today's episode. We're diving into a captivating topic, effective approaches in emergency medicine. When you're in the emergency department, or ED as we call it, it's all about having reliable frameworks to guide you under pressure. It's really less about memorizing facts and more about honing your thought process.
That sounds intense. So, what do you mean by frameworks? Like, are they specific methods or something?
Great question. Picture it as a GPS for your brain in a crisis. For instance, Phase 1 focuses on assessing whether a patient is sick or not. You need to take stock of their work of breathing, skin color, mental status, and body positioning before you even approach them. That initial assessment is crucial for guiding your actions.
Wow, that's really interesting. So, it's almost like reading body language in a way?
Exactly. It taps into your instincts. I recall a time when a young man rushed in, looking pale and breathing heavily like he'd just sprinted a marathon. That initial impression was a game changer. It told me that something was really off.
Oh man, that sounds dramatic. So what's next after that initial assessment?
Immediately, you must prioritize safety. As you're assessing, you must also start monitoring and establish IV access. It's vital to provide oxygen if needed. In critical situations, these basics can literally save lives.
I can see how that'd be crucial. Like, it's all about speed, right? What if they need more intense interventions?
Absolutely. You also want to rule out serious conditions right away. If someone presents with chest pain or difficulty breathing, you need to think about major concerns like a heart attack or pulmonary embolism immediately.
Ugh, that's terrifying. So you have to think fast, huh? But how do you keep track of everything in your head?
That's the beauty of a structured approach. It starts with your impression and safety checks. Then you navigate to a focused history and examination, ultimately building a differential diagnosis, a list of potential conditions. It's akin to piecing together a puzzle.
Like building a fortress of medical knowledge?
Haha, exactly. And after you initiate treatment, don't forget to reassess your effectiveness. If it doesn't work, you need to be flexible enough to adjust your interventions.
So, can you give me like a more specific example about something clinical? Maybe something like shortness of breath?
Absolutely. Phase 2 is where the rubber meets the road. When a patient comes in with shortness of breath, you should instantly pay attention to their breathing pattern and distress signs. Monitoring and IV access become non-negotiable.
Wow, that's so detailed. I can imagine someone, like, gasping for air and you. So how do you differentiate conditions in such a chaotic moment?
Right? So when you're ruling out significant conditions, look for signs like stridor indicating airway obstruction or tracheal deviation signaling a tension pneumothorax. For a large pulmonary embolism, assess for symptoms like hypotension or severe hypoxia. Keeping a sharp eye is critical.
Ugh, it sounds like a game of medical chess. What do you do for, your follow-up after treatment?
Great form of analogy. After an initial assessment, you continue to maintain a differential diagnosis and think about exacerbations from conditions like congestive heart failure or asthma. Conduct tests to uncover the roots. It's about being Sherlock Holmes on the scene.
And how often do you, reassess? Like, is it a strict time thing?
Excellent point. You should reassess frequently, like every few minutes after interventions. This tells you if your treatments worked or if you need to tweak your plan.
Wow, I can see how doing all this would make me reflect. How do you, keep improving after a busy shift?
That brings us to Phase 3, continuous improvement. After each shift, take time to reflect on your performance. Identify not only what went well, but also areas for growth. Being aware of cognitive biases is essential too, and leveraging resources like books or courses can significantly boost your knowledge.
I bet there's a ton of stuff to learn. So all these experiences consolidate your skills?
Yes, deliberate practice during quieter times in the ED helps refine and solidify skills for busy shifts. It's about making solid connections amid chaos.
It's like leveling up in a video game, huh?
Haha, precisely. Just like a game, having strong frameworks allows you to prioritize patient safety and hone your care approach continually. Structuring your knowledge application is critical for success in the ED.
I can't get over how fascinating this is. Thanks for this deep dive.